Hi, I'm Andrew Boulton. I'm immediate past president of the European Association for the Study of Diabetes until the end of last year. So this year I've actually been able to attend one or two sessions, although I have to admit I'm still pretty busy with meetings, and I've just taken over as president of the Worldwide Initiative for Diabetes Education. But I remain active clinically, and I guess I'm best known for my work in the area of peripheral neuropathy and diabetic foot disease. And an interesting presentation that caught my attention this year was one from Sheffield in England, where they're emphasizing the annual review for screening. All our diabetic patients, of course, should be screened annually for a risk of complications. And they had the idea, if everybody in England is called for an annual photograph, which of course screens them for diabetic retinopathy, could we not add to that the screening for kidney disease and for peripheral nerve disease? So in the presentation they showed it was entirely feasible when the patient attends the optician for screening for diabetic eye disease, that while the drops were dilating the fundi, a quick foot exam could be done by a trained individual, and also looking for evidence of microalbuminuria. And I think we're facing an epidemic of type 2 diabetes, and screening is going to be essential from the diagnosis, because we mustn't forget that type 2 diabetes can present with the late complications. So why not, when you're screening for one complication, screen for the others as well? In another study, my colleagues and I in Manchester have been putting a machine that can look at the corneal nerves, corneal confocal microscopy, in the opticians. So we can do screening with a photograph for diabetic retinopathy, and at the same time examining corneal nerve fibers, which can be predictive of diabetic neuropathy. So I hope these novel ideas are of interest to you, and I thank you for listening.